Welcome back to The Deep Dive, where we unpack cutting-edge research so you don't have to.
Always exciting to be back.
Today, we're going deep into a grand rounds presentation, all about how tech is shaking up mental health care.
Sounds fascinating.
It is. It's called Transforming Minds, the role of technology in mental health care.
Okay.
And it was presented by Dr. Zhao and Dr. Roitman at Maimonides Medical Center for their psychiatry department.
Great.
Part of me hopes the AI putting this deep dive together for us is, doing a good job.
Yeah.
And the other part's kind of worried it's secretly learning how to, diagnose us all.
Let's hope not.
Right. But in all seriousness, technology is changing the mental health landscape fast.
For sure.
And this Grand Rounds presentation really captures that.
I agree.
So we'll be breaking down some key terms, talking about the ethical stuff, which is always a big one.
Yeah.
And then we'll really dive into how tech is impacting every single stage of a patient's journey.
Okay.
And since you're already a mental health pro, we can skip the 101.
Sounds good.
Let's jump right into the deep end.
Let's do it.
First things first, let's define some of the big terms that keep popping up in this space.
Sure. We have generative AI. It's this type of artificial intelligence, right?
Right.
And it can create new content like text, images, music, you name it.
Oh, wow.
And it's all based on the data it's been trained on. This is different from traditional AI, which, is more rule-based. It can't really learn or adapt on its own.
Oh, I see.
Generative AI uses machine learning models to spot patterns and then create something totally new.
So, like those AI image generators everyone's using.
Exactly. Those are all powered by generative AI.
It's mind-blowing to think about how we might see this used in mental health, creatively.
Yeah, the possibilities are really exciting.
Yeah. Okay, so then we've also got these large language models.
Right, LLMs.
LLMs, yeah.
They're closely tied to generative AI.
Okay.
So these systems are trained on just massive amounts of text data, which means they can understand and generate human language, amazingly well.
So, the chatbots that sound so human, it's almost creepy.
Exactly.
Yeah.
LLMs are probably the brains behind those.
Got it. So chatbots, then, are basically computer programs that are made to, chat like a human would.
Yeah.
But obviously, using them in mental health care raises a ton of ethical questions.
Absolutely.
About privacy and accuracy.
Yeah.
And even the potential for harm, right?
Huge concerns. We have to be incredibly careful and make sure these tools are used ethically, responsibly.
100%. Okay, moving on. What about digital therapeutics? I've been hearing that term a lot lately.
Yeah, they're becoming really important. Basically, they're software applications, but they're based on real evidence-based interventions to treat, manage, prevent mental health conditions.
So it's like a digital version of, say, medication, but instead of a pill, it's an app.
Yeah, that's a good way to put it. And they're held to very similar standards as traditional medications.
Wow.
They go through rigorous testing. They have to prove they work.
I didn't realize that.
It's serious stuff. Okay, and then there's this interesting concept called the uncanny valley. Have you heard of that?
Vaguely, but remind me.
It's basically this feeling of unease we get when something looks almost human, but not quite.
Oh, right.
Like those super realistic robots.
Yeah.
They're amazing technologically, but there's just something about them that makes us uncomfortable.
Yeah, it's a little creepy.
And this idea is actually really relevant to using AI in mental health.
How so?
Well, because building trust and connection is so vital in therapy.
Of course.
And if the technology feels too artificial or weird, it could actually hinder the therapeutic process.
Right. We don't want the technology to, creep people out.
Exactly. We want it to facilitate a good experience, not make it worse.
Okay, so we've got the terminology down. Now let's look at how these technologies are actually being used in the real world.
Yeah, let's get practical.
So Dr. Zahn and Dr. Roitman's presentation, they highlight these 5 key stages in a patient's journey: access, diagnosis, treatment, monitoring, and support.
A comprehensive approach.
Yeah, so let's start with access.
Okay.
What are they saying about that?
Well, they talk about the rise of telepsychiatry and virtual care platforms.
Right.
And it's been huge. You've got companies like Talkspace, BetterHelp, Growth Therapy.
Yeah, I've heard of those.
They've become really popular, offering remote access to mental health services.
Makes sense.
And, of course, the COVID-19 pandemic really accelerated this whole trend.
Of course, yeah.
With the lockdowns and the increase in mental health needs.
Right.
And the restrictions on in-person care. it all just pushed telehealth into the spotlight.
Yeah, it felt like virtual therapy sessions became the norm almost overnight.
It really did. And it had a massive impact on access to care, especially for groups that traditionally face barriers.
Oh, interesting. Like who?
People in rural communities, the uninsured, individuals over 55,
Good.
women, Hispanic populations, they all saw increases in access because of telehealth.
So telehealth really leveled the playing field in some ways.
To a large extent, yes. And part of this was due to regulatory changes made in response to the pandemic.
Like what?
They removed the in-person requirements for Medicare billing, for example, and they implemented reimbursement parity with in-person visits.
Oh, virtual visits are finally being taken seriously by insurance companies.
It's a step in the right direction, but of course, with this rapid expansion comes some challenges too.
Right. I imagine there are some downsides as well.
Definitely. There are concerns about ethical prescribing practices, the digital divide, and making sure the quality of care is good in a virtual setting.
Yeah, that makes sense.
I mean, the Department of Justice actually filed charges against some companies. They were exploiting those COVID-19 flexibilities and basically running what they called pill mills,
Wow.
prescribing controlled substances without proper evaluations.
That's scary. It's a reminder that even with all the good intentions, there's always potential for misuse.
Absolutely.
So where do we go from here? What's the future of telemental health looking like?
Well, now that we're moving beyond the pandemic, the focus is shifting a bit.
In what way?
It's about integrating telemental health into the existing healthcare systems, making sure there's insurance coverage,
Right.
developing better algorithms for matching patients with therapists,
That sense.
and moving towards what's called value-based care, where payment is tied to patient outcomes, not just the number of sessions.
Oh, interesting.
Yeah, so platforms like Talkatary are actually getting a lot of funding right now.
Okay.
They're focused on scaling their value-based telemental health models, emphasizing quality care over quantity.
That's encouraging. It sounds like the focus is shifting from just providing access to making sure that access is actually leading to good outcomes.
Exactly. Quality over quantity.
I like that. So let's talk about some of the specific platforms that are shaping the telehealth landscape.
Okay.
You mentioned BetterHelp and Talkspace before.
They're two of the big players.
What are they doing that's interesting?
They're using technology to streamline the whole intake process.
Okay.
And they're trying to connect patients with the right therapists for their needs.
How does that work?
Like, BetterHelp uses questionnaires and multiple choice prompts to gather information about the patient.
Okay.
What they're looking for, what their preferences are.
So it's very user-friendly.
Yeah, they're trying to make it easy for people to get started.
That's great. Are there any platforms out there that focus specifically on supporting the providers?
Yeah, absolutely. Growth Therapy is a good example.
What do they do?
They help with all those administrative tasks that can be so time-consuming.
Like what?
Scheduling, billing, marketing.
Oh, that's helpful.
Yeah, it frees up the therapist to focus on what they do best, patient care.
It sounds like there's a lot of innovation happening in the telehealth space.
Tons.
It's really exciting to see how technology is expanding access to mental health services.
It's really revolutionizing the field.
Yeah. So let's move on to the next stage of the patient journey, diagnosis and treatment planning.
Okay, sounds good.
What role does technology play there?
Well, we're seeing increasing integration of AI and machine learning,
Okay.
along with wearable devices and provider support tools.
Right.
AI, in particular, is being integrated into major electronic health record platforms, like Epic, Oracle Cerner, and Abridge.
Got it.
So it's helping with things like documentation and analyzing patient data.
Making things more efficient.
Exactly. And the whole landscape of AI in healthcare has changed dramatically, especially since ChatGPT came out in November 2022.
Right, ChatGPT, everyone's talking about it.
Exactly. And if you look at the Rock Health Innovation Maturity Curve, you can actually see that AI in healthcare is moving from emerging to developing.
So it's becoming more mainstream.
Definitely. And there are a few key indicators of this.
Okay.
First, there's increased funding. In 2024 alone, digital health got $3.3 billion in venture funding. And 36% of that was specifically earmarked for AI.
That's a lot of money.
It is. And then you've got major healthcare systems adopting these technologies, like Corewell Health.
Right.
They're partnering with companies like Abridge to implement AI-powered documentation tools.
I've actually heard about their pilot program with Abridge. What were the results?
Really impressive. They saw a huge reduction in after-hours documentation time for clinicians.
How much?
It dropped from 4.3 hours per week to just 2.2 hours.
That's a big difference.
It is. And clinician satisfaction went way up. 85% reported increased job satisfaction. 90% felt they could give more focused attention to patients.
That's amazing. It sounds like AI has the potential to really improve both clinician well-being and patient care.
Absolutely. By taking care of some of those tedious administrative burdens.
So what else is happening in this space? Any other interesting partnerships?
Well, there's this really exciting one between Epic and OpenAI.
OpenAI, the company behind ChatGPT.
That's right. They're exploring how generative AI can streamline even more administrative tasks.
Wow.
And even enhance patient communication.
That's incredible. It seems like AI is really poised to revolutionize how we approach diagnosis and treatment planning.
I think so. But we can't forget about the human element in all of this.
Right.
Technology should be a tool to empower clinicians, not replace them.
Absolutely.
It should give them more data, more insights, more efficiency.
So they can focus on what truly matters.
Exactly. The patient.
Well said. Okay, we've covered access and diagnosis. Let's move on to the next stage in the patient journey.
Sounds good.
Treatment delivery.
So when we're talking about treatment delivery,
Yeah.
digital therapeutics are really front and center.
Oh.
These software applications.
Great.
They're built on evidence-based interventions.
Okay.
They're designed to treat,
Yeah.
manage, and even prevent mental health conditions.
So they offer like an alternative to traditional therapies.
Yeah, they can be an alternative.
Or they could be used together too, right?
Absolutely. Yeah, they can complement existing therapies.
Interesting.
And we're seeing other cool stuff too, like virtual reality being used,
Oh.
chatbots, even things coming out of biotech and pharmaceutical companies.
So digital therapeutics sounds really promising.
Yeah.
Are there like actual examples of these being used successfully, like in real life?
Oh, yeah, for sure.
Okay.
There's Rejoin.
Rejoin.
Yeah, it was actually the first FDA-approved digital therapeutic for major depressive disorder.
Oh, wow.
It was a huge deal.
Yeah.
It showed that digital therapeutics are being taken seriously as legitimate treatment options.
That's great.
So Rejoin, it's a 6-week program,
Okay.
and it uses brain training exercises and then these short skills-based therapy lessons.
And people can like do it on their own time.
Exactly. It's very flexible, and studies show really high adherence rates.
Like how high?
88.1% of patients actually complete the whole program.
Wow, that's pretty good.
Yeah, it
Okay.
is.
So how does it actually compare to traditional therapy? Like, does it actually work?
Well, Rejoin went through a bunch of clinical trials, and the results are pretty promising.
What did they find?
They found a 51.3% full or partial response rate,
Yep.
and 18.2% of patients actually achieved remission.
Wow.
And another big thing, no adverse events were reported.
That's really good.
So it seems to be both safe and effective.
So it really could be a good alternative for some people.
It could be, yeah.
Are there any other digital therapeutics out there that have been successful?
Yeah, there's Sleepio.
Sleepio, what's that for?
It's designed for insomnia.
Okay.
It's really cool. It's backed by a ton of research.
Like what kind of research?
Over 90 peer-reviewed publications,
Wow.
18 randomized controlled trials,
Okay.
and they've had over 28,000 participants in their studies.
That's a lot.
Yeah, and they've shown some really impressive results.
Like?
76% of the participants had significant improvements in their sleep. The program uses cognitive behavioral therapy techniques to help people, build good sleep habits and address whatever's causing their sleep problems.
So there's actual science behind it.
Oh, yeah, definitely.
That's good to know. It's not just some random app.
Right.
It's based on real proven methods.
So is it easy for people to access these kinds of digital therapeutics?
Well, that's actually been a barrier in the past,
Okay.
but there's been some good news recently.
What's that?
In November 2024, CMS, the Centers for Medicare and Medicaid Services,
Yeah.
they introduced reimbursement codes specifically for mental health digital therapeutics.
Oh, wow.
It's a really big deal.
Yeah, so insurance will actually cover it now.
It's a step towards that.
Okay.
It means providers can now bill Medicare for the time they spend using these tools with their patients.
That's great news.
Yeah, it could really open up access for a lot of people.
That's really encouraging.
It really is a major step forward for the field. So what about other, tech-driven treatment options? I've heard some buzz about AI being used in narrative therapy for PTSD.
Yeah, there's a platform called My What If.
My what if?
It uses AI and narrative therapy techniques to help people with PTSD process and reframe their experiences.
So how does that work?
Well, narrative therapy is all about helping people understand their stories
Okay.
and find new meaning and perspective so they can move forward.
Okay.
And there's a lot of research that shows narrative therapy is effective for PTSD.
That's good.
And AI can really help scale this approach, make it available to more people.
So it's like AI is making therapy more accessible.
In a way, yeah.
That's interesting.
And it can also tailor the therapy to individual needs.
Oh, so it's more personalized.
Exactly.
That's really cool.
It's exciting to see how AI is being used to enhance proven therapeutic techniques.
It is, yeah.
And it's not just about treatment either.
Right.
Monitoring and follow-up care are really important too. And technology is playing a bigger and bigger role there,
Okay.
especially through wearable devices and mobile health apps.
I can see how those would be helpful.
Yeah, they can provide continuous insights into how someone is doing. They track things like sleep patterns, activity levels, heart rate variability, even subtle changes in your voice.
Wow, really?
Yeah, and all that data can inform treatment decisions and personalized care.
It's amazing how much information these devices can gather.
It is.
But do you think people are comfortable sharing all that personal data? Like, what about privacy concerns?
That's a really important point.
Yeah.
Privacy and data security are crucial, especially with health information.
Of course.
But the potential benefits of having this data are huge.
Like what?
Imagine being able to detect early warning signs of a depressive episode,
Okay.
just based on changes in someone's sleep or activity levels.
That would be incredible.
It would. You could intervene early and potentially prevent a full relapse.
So we're talking about predictive analytics. Wow, that could really change the game.
Yeah, researchers are working on this right now.
Really?
There's this study at UCLA called the Grand Depression Challenge.
Grand Depression Challenge.
It started in 2020,
Okay.
and it's the first study of its kind using digital sensing.
So what are they sensing?
They're using iPhones, Apple Watches, and sleep monitors to collect data.
Wow.
They're looking for patterns and relationships between daily routines, sleep, activity, and then the participants' self-reported anxiety and depression symptoms.
So they're trying to build like a forecasting system for depression.
Exactly.
That's fascinating.
They want to identify early indicators so we can detect depression earlier and intervene sooner.
That could have a huge impact on people's lives.
Absolutely. And they're also looking at the idea of different subtypes of depression.
Subtypes.
Yeah, which
Yeah.
could lead to more personalized treatment approaches.
That makes sense.
The more we understand about the different ways depression manifests, the better we can tailor treatment.
Right. It's not one size fits all.
Exactly.
So are there any companies doing this kind of work too?
Oh, yeah. Apple's been incorporating mental health features into their operating systems.
Oh, interesting.
iOS 17, iPadOS 17, watchOS 10, they all have new mental health stuff.
Okay.
And they even made the Health app available on iPad.
So people have more ways to track and manage their mental well-being.
Exactly. And the fact that Apple's focusing on this data collection just shows how mainstream mental health is becoming.
It's good to see them taking it seriously.
It is, and the technology in wearable devices is getting really advanced too.
Like what?
The Oura Ring, for example, can track stress levels throughout the day.
Wow, really?
Yeah, it's pretty amazing.
So it's like having a little stress monitor right on your finger.
Pretty much, and it can give you insights and personalized recommendations for managing stress.
So it's not just collecting data, it's actually helping you do something with it.
Right, it's about turning data into actionable insights.
That's cool.
There are also companies looking at voice-based biomarkers.
Voice-based biomarkers, what's that?
They're using AI to analyze people's voices
Okay.
to detect signs of depression or anxiety.
Really? Just from your voice?
Yeah, there are subtle changes in your voice that can indicate those things.
Wow, I had no idea.
And this could be a really easy and non-invasive screening tool.
That would be amazing.
It would, especially for people who might not be comfortable seeking traditional help.
It feels like we're moving towards this future where technology can help us understand and manage our mental health in ways we never thought possible.
It's really exciting, but we have to be careful too.
Of course.
We need to make sure all these advancements are used ethically and responsibly for the
Right.
benefit of everyone.
Well said.
So we've talked about access, diagnosis, and treatment,
Right.
and we've touched on monitoring,
Yeah.
but there's one more stage in the patient journey that we need to talk about:
Okay, what's that?
support and maintenance. So support and maintenance, that last stage of the patient journey,
Okay.
it's all about giving people the tools to manage their mental health proactively. you know?
Right, preventing those relapses.
Exactly. And technology is a big part of that now.
I can see how.
It offers all these resources to support self-care,
Okay.
promote well-being, and build a sense of community.
Like connecting with others.
Exactly. People who understand what they're going through.
So it's kind of shifting the focus from just reacting to problems to, like, being proactive about your well-being.
Yeah, it's a big change.
A good change, though.
Definitely.
So what are some of the ways technology is being used for this support and maintenance stage?
We're seeing a huge rise in mobile health apps.
Okay, health apps.
Yeah, they're designed for all sorts of things.
That cool.
Self-care, well-being coaching, peer-to-peer support, even chatbot-based therapy.
Oh, wow.
And this trend is especially strong among younger people, Gen Z and millennials.
They're always on their phones. It makes sense.
They are, and they're really prioritizing their mental and physical health, which is great.
It is.
They're actively looking for tools to help them, and they're comfortable using technology for it.
It's encouraging to see them taking charge of their well-being.
Yeah, it is.
So what's driving this trend, do you think? Why are younger generations so focused on this?
Well, for one thing, they're the ones leading the way in spending on wellness products and services.
Really?
Yep, the data shows it. I think they're just more aware of mental health issues than previous generations.
Maybe because it's talked about more openly now.
I think that's part of it.
Yeah.
And they're also more open to seeking help and support.
It's not so stigmatized anymore.
Exactly.
Okay, so they're looking for help.
Yeah.
But there are so many apps and platforms out there.
It's overwhelming.
How do they know which ones are actually good?
That's a really important question.
Yeah. What should they be looking for?
I think the biggest thing is scientific credibility.
Okay.
They should be looking for apps and platforms that are backed by research, you know?
Right, not just some random app that someone threw together.
Exactly. They need evidence-based solutions, things that have been clinically tested.
And how can mental health providers help with this?
I think clinicians play a crucial role here.
Okay.
They can guide their patients towards the tools that are actually effective.
Right, because they're the experts.
Exactly.
People trust their doctors.
And that trust is really important, especially with younger generations.
Yeah, they're more likely to listen to their doctor's recommendations.
I think so.
So it sounds like mental health professionals need to stay up to date on all these new technologies.
They do. It's a constantly evolving field.
It is, yeah.
It's not just about prescribing medication anymore.
Right. It's about integrating technology into the treatment plan.
Giving personalized recommendations for apps, wearable devices, all these different tools.
So it's like a holistic approach.
Exactly. It's about giving patients a whole toolkit to support their well-being.
I like that.
And speaking of evidence-based practices, we can't forget about the power of something as simple as meditation.
Oh, absolutely.
There's so much research showing the benefits of meditation.
It can really change your brain.
It can, especially in areas related to emotional regulation and stress reduction.
It's amazing how something so ancient can be so relevant today.
Yeah, it's really powerful.
It's like technology can do so much, but sometimes the simplest things are still the best.
It's about finding that balance, you know?
Right, using technology strategically.
And not forgetting about the foundational practices that have always been there.
The things that build resilience.
Exactly.
Okay, so as we wrap up our deep dive into technology and mental health,
Yeah.
what are some key takeaways you want our listeners to remember?
Well, first of all, the field is changing fast.
That's clear.
Technology is driving that change.
From telepsychiatry to digital therapeutics, wearable devices, AI chatbots.
It's really impacting every aspect of mental health care.
It's exciting, but it also requires careful consideration.
Absolutely.
We have to make sure this technology is used responsibly.
For the benefit of everyone.
And ethically, of course.
Of course, patient privacy, data security, equitable access, these are all things we need to be thinking about.
And as mental health providers, we have a responsibility to stay informed.
To engage in these conversations.
And advocate for the responsible development and integration of these technologies.
Exactly. We need to be part of shaping this future.
Because the future of mental health is intertwined with the future of technology.
It is, and it's up to us to make sure that future is a good one.
Well said. Thank you for joining us on this deep dive into the world of technology and mental health.
It's been a pleasure.
We hope you found it insightful and maybe even a little bit inspiring.
I hope so.
And who knows, maybe our AI is out there learning from this conversation too.
Let's hope it's using its knowledge for good.
Right. We'll have to keep an eye on it.
Until next time.
Take care, everyone.